Shadow Environment Minister for the Alberta Liberal Caucus, and it's a great honor for me to be chairing and hosting, in some ways, this with some colleagues and friends whom I've developed over the years and who've got an abiding interest in this fluoride issue. The great irony here, of course, is that I was the Associate Medical Officer of Health in the city of Calgary that managed to get fluoride into the water in 1990.
Oh, shame.
Oh, you mean this crowd is anti-fluoride? I thought this was a mixed crowd. There may be some people who aren't entirely anti-fluoride. Jim, you're stepping on my court. Thank you. I won't take much time because really I'm here to facilitate discussion and open up new avenues of information and review through what is an appropriate democratic process, decisions that have been made and decisions that may need to be changed over the course of time with new information and new insights. And I am here very much to honor the democratic principle and honor these folks. Dr. Jim Beck on my right, former fellow colleague at the University of Calgary Medical School. Dr. Bob Dixon, who's a practitioner in the community and had a strong interest in this issue, written several articles. Faye Ash, who's at the door helping people get information they need and has been a very long-standing advocate for reviewing and removing fluoride from our water supply, along with Jack Locke, who was an old friend of mine, and Jack brought me into court 15 years ago and asked me a very basic question. He said, Dr. Swan, would you ever give someone a medication against their will? And I said, well, yes, I would. He said, what? Under what circumstances would you do that? I said, well, if they were unconscious and close to death, I would just administer whatever I felt was appropriate. He said, oh, phew, thank you. And we went on with the discussion, which was a very important discussion of the ethical dimensions of this whole question. I will introduce Dr. Paul Connett, who's on my left, after we hear from Jim Beck. The plan for the evening is that Jim would speak, then Dr. Paul Connett would speak, and then we might take a bit of a break if you wish to stretch, and then have some open dialogue and discussion, questions, answers, comments with people in the audience and the people on the panel. I'm sure there's a rich diversity of views and experiences here, and we need to hear from it all, with a view to deciding what to do about a decision that was made 15 years ago in the province, in the city of Calgary. And it is a municipal decision, one that each municipality is now making independently on the basis of its own assessments. So I'll turn the microphone over to Dr. Jim Beck and welcome his comments on what he's researched in the last few years on fluoride in water.
Thank you, David. I would first like to suggest a framework for looking at the problem. If you took a look at it and say, well, what is fluoridation of public water supplies? What are its consequences? And is it okay? Or do we need to look at it again? Or do we need to stop it? It looks like a very complex problem, and some people might feel overwhelmed by it. So I'd like to divide the question into 3 questions. And each one in itself is a little simpler. In fact, only one of these 3 is very complicated. The first question I think we should ask about this, is it effective? Now, fluoride is put in our water system specifically to reduce the incidence of dental cavities. So the first question is, does it really do that? Then the second question, is it safe to put fluoride in the city's water supply? By the way, I'm using fluoride in a generic sense here. In this global sense, it includes the fluorine ion. It includes, the fluoride ion, and it includes all compounds of fluorine with other atoms. And so we have to ask, is it safe to fluoridate the city's water supply? And which means looking at toxicities on various body systems. And that's where the complications enter, because sometimes the associations between apparent side effects and the fluoridation are not entirely clear. So we will try to deal with that tonight. Then Dr. Connett, who's very knowledgeable about this, will help us through that. And the third question, is it medically ethical? Because there are certain standards we should follow, we're required to follow, in administering a procedure or a medication to any person. So those are three questions. Is it effective? Is it safe? Is it ethical? So I'll just spend a few minutes laying out the ethical part, and then I'll turn it over to Dr. Connett to deal with the efficacy and toxicity issues. Our present practices in what we usually call the Western developed world with respect to the ethics of medication or application of procedures to human beings are based on the Nuremberg Code and the subsequent developments of that code that have occurred over the past few decades. So and what follows, what I'll say now, applies clearly to Canada and Europe and the United States specifically. The one principle is that the substance or procedure to be administered must have been tested by competent authorities, and tested for efficacy and tested for toxicity. It must have been produced under certain rigid conditions. For example, a medication that is ingested must have been produced in a sanitary way, and it must come out of that production process pure. And this, and then after that hurdle is overcome, it must be administered by a qualified health professional. Now, these are general principles now. I'm not talking specifically about fluoride. What I propose to do is to lay out this code very briefly, and then we can ask the question, does fluoride fit? Now, another principle is the person who is subject to the medication or to the procedure must be fully informed and give his or her consent freely. And that being fully informed is explicitly described in this code in most of our jurisdictions as being informed by a health professional, usually a physician, to an individual in the context of the condition of that individual. And the information must be explained in terms that the individual can understand. So, after being informed, then the administration of the medication or procedure must be monitored by a qualified health professional. And the person who receives the substance or the procedure must be able to stop it without any hindrance. Now, the dosage, this monitoring includes monitoring of dosage and the effects on the person throughout the procedure, the time in which it is administered. Now, clearly, these are very stringent requirements. And most of us would agree that they should be, because they're designed to control to prevent the administration of substances which are dangerous, or substances which are not effective, substances which have side effects which are disadvantageous to the person. And so that shouldn't bother us, that these are very stringent requirements. It's only reasonable in this context. But I should point out that, of course, there are instances in which some of these precautions can be overridden. But this applies only in the case of a life-threatening, contagious disease, for example, where there's a public health concern. So if someone is violating one of these stringent requirements, they must have demonstrated that this is in order to prevent or control a contagious, life-threatening disease. Now, there are examples of such exceptions to the code, but there are very few. Among all the medications and procedures that are administered to people, they're a very, very small fraction. Now in this context, we can ask the question, how does putting hydrofluorosilicic acid in the city's water supply shape up? Because what's put in the case of Calgary, in most places, certainly in North America, where water systems are fluoridated, it's done with hydrofluorosilicic acid, which, when added to water, produces not just fluoride ion, but a variety of compounds, not all of which are understood. So, in fact, I should point out that we're really not certain what's produced when we add hydrofluorosilicic acid to our water. Now, furthermore, this substance we add, hydrofluorosilicic acid, has not been approved for administration to human beings, neither in the United States nor in Canada. And in fact, many European countries have outlawed the addition of fluoride in any of its forms to drinking water, so that even local jurisdictions within those countries are not allowed to do it. They're prevented by law. So we should also keep in mind that this substance that's added to our water is not pure. It's a byproduct of an industrial process, and it contains contaminants, among them heavy metals, arsenic, and so on. Now, though the city's water is not filthy with arsenic, I don't want you to give you that impression. It's carefully observed and monitored at all times. But there are things, the tolerance levels for arsenic, for example, for things that are consumed by humans is 0. And in our water supply, it's not 0. There's arsenic in small, very small quantities, to be sure. Now, the point about informed consent, how does that apply to fluoridation of our city water supply? Well, it's quite clear that probably not a single Calgarian has ever been informed one-on-one with a physician who is taking into consideration that individual's condition about the effects, the consequences of drinking this water with that added substance, or even a discussion of whether it's effective for the purpose for which it's given. So I think we could also say that none of us can, as an individual, successfully demand of the city that they stop putting it in our water. That request would be laughed down. And one of the ethical principles here in the code is that the subject must be able at any time to stop the procedure or stop the medication. So another point is about monitoring how this is done is the dosage. The city carefully controls how much they put in the water, but they don't know how much we put in our bodies using that water. Because we get fluoride in its various forms from many other sources. Food, often processed with fluoridated water, and so on. But even if we didn't get that, there are people among us, say, who work on hot days, and they're training athletes, or they work in construction, and they drink liter after liter of tap water. Whereas other people sitting having a sedentary job in an air-conditioned office, they're drinking very, very little water. So that there's surely more than a 10-fold difference among us as to what we ingest in a day of fluoridated water, so that we had no idea what people were taking in. And generally, about half of the fluoride that we ingest is quickly absorbed into body tissues such as bone. So if you drink more of this, you're going to get more into the different body systems. And no one will know how much that is. So another point, of course, on the ethical issues is it's not administered by qualified professionals. And the city council is not composed of physicians registered to practice medicine in Alberta. And the effects it has on us is certainly not monitored. Has anybody from the city asked you how you feel? And so it seems clear, that we have to conclude that as it's done in Calgary, it's not ethical. It's not, even if one thinks of the exception for preventing a life-threatening contagious disease, if that's the argument, you would have expected the city council to have satisfied us that dental caries is a life-threatening infectious disease. And not many rational people can make that claim. So, and the last point is that in order to administer a procedure or give a medication for a certain purpose, for which there is some other preventive measure, which is less questionable, then that means that disqualifies the first. If there's a better way to do it under those circumstances, it should be done a better way. So now, with those ethical considerations, let me leave to Dr. Connett the problem of efficacy as a preventive for dental caries and the problem of toxicity.
Thank you very much, Dr. Jim Beck. Dr. Paul Connett is a graduate of Cambridge University. He holds a PhD in chemistry from Dartmouth College. Since 1983, he's taught chemistry at St. Lawrence University in Canton, New York, where he specializes in environmental chemistry and toxicology. Over the past 21 years, his research on waste management has taken him to 49 states in the US and 48 other countries, where he's given approximately 2,000 pro bono public presentations. Ralph Nader said of Paul Connett, quotes, "He is the only person I know who can make waste interesting." He has co-authored 6 peer-reviewed articles on dioxin and other articles on waste management. Paul Connett has researched the literature on fluoride's toxicity and the fluoridation debate for 10 years. He helped found the Fluoride Action Network, and there's a website, fluoridealert.org, if anyone's interested. He has given invited presentations to the Fluoridation Forum in Ireland, the Japanese Society for Fluoride Research, the American College of Toxicology, the U.S. Environmental Protection Agency, U.S. National Research Council, the International Society for Fluoride Research in New Zealand and Germany, and the Joint Parliamentary Committee on Health and Children in Ireland. Let's welcome Dr. Paul Connett.
Well, thank you very much for having me here. If you need to contact me, this is my email address. It's long but easy to remember, paul@americanhealthstudies.org. I send out regular bulletins on this issue. They're free, and if you would like to receive them, just let me know. When I'm home, they come out about once a day. I'm going to be slowed down because I'm having a hip operation next month, so it'll be a little lighter. And this is our website. It's either fluoridealert.org or fluorideaction.net. I don't use fluoridealert.org because the American Dental Association captured all the sites around there. If you were to type in fluoridealert.net or fluoridealert.com, you get the American Dental Association, not our webpage. Now, it was the intention of Jim, Beck, and the other organizers to have somebody presenting the alternative point of view. But unfortunately, these people often develop all kinds of weird diseases which prevent them from ever being on the same platform as me. To such an extent that I had to actually debate a man-sized or woman-sized chicken in Australia. It sat on the platform and didn't utter a squawk through the whole presentation. Anyway, the health authority that supposedly supports this process was not available to be on part of the forum tonight, which is unfortunate, because I agree with the French writer Joseph Joubert, who said, "'Tis better to debate an issue without resolving it than to resolve the issue without debating it." Debates are especially important when you remember that in science, an ugly fact, and I forgot who said this, it may have been Pasteur, an ugly fact can destroy a beautiful theory. And there are some ugly facts that destroy the beautiful fluoridation theory. It was rather nice, wasn't it, to sprinkle a little pixie dust in the water supply and then cure tooth decay. I mean, that was what was sold to the American people in 1950, along with DDT, sprayed on kids at picnics, along with asbestos lining our pipes, along with PCBs in all our transformers. They've all gone by the wayside, but somehow fluoridation clings on. Well, most countries do not do it, but their teeth are just as good as those that do. It's unethical. You've heard from Jim just why it's unethical. Fluoride works topically, not systemically. Why on earth you would swallow something that works topically, I don't know. Ingested fluoride is ineffective. I should go into the details of that. 1 part per million is not small. That's the level, or 0.7, which is more or less the same. It is not small. There are many health risks. I should go into those. There is no adequate margin of safety. That's a very key issue, which is seldom addressed by promoters. Some people are very sensitive to fluoride, and their interests are out of the window, which I think should have been incorporated in the ethical discussion. If some people have to suffer because other people are getting a benefit, I don't think that's ethical. It penalizes poor families, which is a very interesting argument, considering that one of the key promoting arguments is that you do this for poor families. It's promoted unscientifically, and as you've heard, the chemicals used are not pharmaceutical grade. I'm going to look at some of those arguments, but not all of them. Most countries have rejected the notion of using the public water supply to deliver medication. This is a very unusual practice. They've only done this once before with iodine, and after a relatively short time, people came down with hyperthyroidism. There's some people getting too much iodine, so they quickly stopped that. This is the only other time that we've used the public water supply to deliver medicine. And you've heard some of the reasons why that's a very clumsy medical practice. Only 7 or 8 countries have more than 50% of their populations drinking fluoridated water. Australia, Colombia, Ireland, Israel. I'm not sure about that. I was in Israel about a month ago, and I think it's less than 50%. Malaysia, New Zealand, Singapore, and the United States. Canada is actually less than 50%. Hopefully it'll be much less than 50% soon. Here are some of the countries in Europe which are non-fluoridated. I mean, they're very important countries: Austria, Belgium, Denmark, Finland, France, Germany, Greece, Iceland, Italy, Luxembourg, and so on. Whole of Scandinavia does not fluoridate its water. Some fluoridate their salt. A minority of countries do not. Some add fluoride to the salt, which gives the recipient some freedom of choice in the matter. Fluoride is unethical, and I won't dwell on this because Jim has done an excellent job. It allows a government to do to the whole community what a doctor cannot do to an individual patient. Force him or her to take medication without their informed consent. Informed consent, the doctor is required to explain to a patient the benefits and the risks of any drug. The patient then decides whether to take the drug or not. Citizens are neither getting the whole story on fluoridation's potential side effects, nor are they being given any choice in the matter. Thus, fluoridation violates the individual's right to informed consent to medication. Fluoridation is an inappropriate delivery system for fluoride. As again Jim has made clear, you cannot control the dose that people get. Please note, that some promoters claim that the health risks of fluoridation can be controlled by controlling the concentration, and make a big point that the water engineers can control to 0.7 or 0.65 or whatever, and they give you the range of variation. But as Jim again made clear, there's a difference between concentration and dose. Concentration is milligrams per liter, dose is milligrams per day. And how many milligrams per day you get, which is the critical thing for health, depends A, on how much water you drink, and how much fluoride you get from other sources, from toothpaste, dental products, from pesticide residues, from air pollution, and so on and so on. Now, fluoride's main benefit is topical. It works on the outside of the tooth. This has been conceded by the #1 promoter of fluoridation. The Center of Disease Control in Atlanta has said in 1999 and again in 2001, whoops, we made a mistake. We used to think that fluoride worked by accumulating in the enamel in the baby before the tooth had erupted, so when it erupted the enamel was strengthened. They said no, we've now shown from laboratory and epidemiological studies that not enough fluoride is incorporated in the enamel in this growth period, and it works from the outside of the tooth. It is topical, predominantly topical. In my view, that should have stopped fluoridation right then in its tracks when the #1 promoter said it's topical. Swallowing tooth fluoride to fight tooth decay makes as much sense as swallowing the cream, the lotion which is used to protect your skin against UV light. Could you imagine, you know, rather than smear this stuff and make myself look like an Eskimo in hot climates, I take the whole lot, squeeze it. I mean, nobody would do that. Or if you did it, you would, the first thing you say, well, is it safe to eat this thing before I swallow it? But no, we swallow it. Now, this is what Arvid Carlsson, who won the Nobel Prize for Medicine in 2000, in fact was the leading opponent of fluoridation in Sweden in the 1970s. In pharmacology, if the effect is local, topical, it's awkward to use it in any other way than as a local treatment. I mean, this is obvious. You have the teeth there, they're available for you. Why drink the stuff? Because they're available for toothpaste, right? That was an interview I had with my son a couple of years ago. Fluoridation is ineffective. Now, again, the Center of Disease Control is an avid promoter of fluoridation. They send their top personnel to state hearings and advocate mandatory statewide fluoridation. They're doing that right now in Oregon, in Arkansas, New Jersey. They're so strongly in favor of this that they want it mandatory statewide. They don't want to fight it out town by town. They want to have it mandatory by state. But in their report, which was the basis for their statement that fluoridation is one of the top 10 public health achievements of the 20th century, they have this figure. It's the only figure in their report. And it shows mean DMFTs, that's decayed, missing and filled teeth for 12-year-olds. This is figures for tooth decay in 12-year-olds, going down from the 60s to the 90s. And on the same graph, they have the percentage of the people drinking fluoridated water going up. Voila! One is coming down because the other's going up. Never mind that I could have put here a curve for the sale of telephone directories or bicycles or many other things were going up at this same period, but these two apparently are related according to the CDC. However, what they could have done is what we did, which was to go to the World Health Organization's database online and checked DMFTs in 12-year-olds, which the World Health Organization tracks in practically every country, and see how they were coming down. And here's the result. Here's the result for 20 countries. 16 of them are non-fluoridated, and 4 are fluoridated. The American line is the red line here. You can see that tooth decay has been coming down dramatically from the 60s to the 90s and beyond in all these countries, regardless of whether they're fluoridated or not. So either that figure from the CDC is fraudulent or it's rank incompetence. I don't know which you prefer. Now, as far as that's comparing countries, as far as the United States is concerned, The largest dental survey ever carried out in the United States was by these folks, Brunel and Carlos. They're from the National Institute for Dental Research, which is a promoter of fluoridation. In actual fact, it was formed on the backs of the fluoridation program in 1948. The teeth of over 39,000 children in 84 communities were examined, and I believe that this study was meant to put the whole issue to rest once and for all. They looked not at decayed, missing and filled teeth. They used a more sensitive measure, decayed, missing and filled surfaces. There are approximately 5 surfaces for a tooth. You know, a tooth is like a cube, and one faces into the gums, the other 5 are exposed, except for the cutting teeth, where they treat as 4 surfaces. So, they looked at the average decayed, missing and filled surfaces for children from 5 to 17 years of age, and they looked at children who'd lived all their lives in a non-fluoridated community, and they found 3.4 decayed, missing and filled surfaces. That is less than 1 tooth. And they compared it with the decayed, missing and filled surfaces for children who lived all their lives in a fluoridated community. And you can do the calculation. If you subtract 2.8 from 3.4, then the average difference in tooth decay, as by this measure, this sensitive measure, is 0.6 of 1 tooth surface out of 5 tooth surfaces in a tooth map. Now remember that. This is the largest survey done by a pro-fluoridation agency in the United States, and all they could find was an average saving of 0.6 of 1 tooth surface, 1 filling. And that's for this, we're going to have the draconian policy of forcing it on people and take the risks that I will share with you. But that's just one survey. Now, subsequent studies have found even less. When Spencer and co-workers in Australia looked at 2 estates in Australia, the average difference was between 0.12 and 0.3 of 1 tooth surface. Even less than the United States. And then when David Locker of the University of Toronto, on behalf of the Ontario Ministry of Health, did a survey of tooth decay, looked at the whole literature. He says the magnitude of fluoridation's effect is not large in absolute terms, is often not statistically significant, and may not be of clinical significance. And if you're interested, I had a 3-way debate on the Health Channel, the Discovery Health Channel, a couple of years back, with David Locker and Dr. Ewan Swan of the Canadian Dental Association. It's only about 24 minutes long, and you can find it on Google Video. And if you can't find it, contact me, and I'll send you the URL, and you can look at this. It's about it's a very rare event to have these guys come on the same platform with me. And what made it particularly interesting is David Locker was agreeing with Ewan on some points and with me on the others, and it was I think, very convincing. In Australia, Armfield and Spencer in 2004 looked at 10,000 children in South Australia and found no statistically significant difference in tooth decay between children who lived all their lives drinking fluoridated water and children who drank rainwater, collected in tanks or bottled water. No statistically significant difference. Now, this is even more recent than that. This is a survey conducted in New York State by the Department of Health of New York State, the Bureau of Dental Health of that department. Again, a promoter of fluoridation. Every single one of these studies is being done by people that support fluoridation. That's very important. This is not our literature or some maverick dentist out there. This is pro-fluoridation stuff. Their literature. So what they collected was the average tooth decay for 3rd graders by county. The average tooth decay by New York State county. All the counties in New York. And here's the data. This is for all the counties in New York State. Now, if there was indeed a relationship between tooth decay in 3rd graders and the percentage of the population drinking fluoridated water, we would expect a line like that. We would expect the people with no fluoridation to have the highest tooth decay, and the people with the most fluoridation to have the lowest tooth decay. And I put the most tooth decay up here, and I put the least tooth decay down there, and drew that line. Is that the line they got? No, this is the line we get. Absolutely no relationship at all between tooth decay in third graders and which county you lived on in terms of how much the county was fluoridated. Now, if you were to do that graph again, and you plot those same figures about with income levels, you do get a decline. In other words, there's a much stronger relationship between tooth decay and income levels, inverse relationship. The lower your income levels, the higher the tooth decay in your kids. It's well established. And this means, unless your survey, unless your study very carefully controls for income levels, you can get any result that you want. That's why you have to be very careful of studies from people with a particular point of view. And this is a relationship which has been observed many times before, and probably explains why we have a number of stories that have come out in American newspapers from cities like Boston, Pittsburgh, Cincinnati, Cleveland, the Bronx, and elsewhere, reporting a dental crisis. We have a dental crisis with our children. And yet these cities have been fluoridated for over 20 years. Why is that? Well, because you have the same problem. That fluoridation cannot deal with with poverty. If your kids are poor, they're going to have tooth decay, whether you have fluoride or not. Now, as another interesting piece of evidence, there have been 4 recent studies, one in 97, the rest in 2000 plus, looking at what happened to tooth decay when they stopped fluoridating in former East Germany. When the two Germanys combined, they stopped fluoridation in East Germany. In Cuba, one community, in Canada, in British Columbia, and in Finland, all places where the community had been fluoridating and stopped. And the expectation was that tooth decay would go up. In actual fact, it has continued to go down. Meanwhile, there's growing evidence that fluoridation is unsafe. Now, let me start with 1 part per million. I know you're 0.7, but I'm going to assume most people have fluoridated 1 part per million. And the difference between 1 part per million and 0.7 is not huge and not significant in my view. Let me put 1 part per million in perspective. There are 3 numbers I want you to know. I'll come to that in a moment. Promoters claim that 1 part per million is so small it couldn't hurt you. But is 1 part per million small? Let me put 1 part per million into perspective by giving you 3 numbers. 0.004, 1, and 4. Now let me explain those 3 numbers. 0.004 parts per million is the level of fluoride in mother's milk. You can get that. That's referenced in this report, which I should be talking about some more in a moment. 1 part per million is the average level at which we put into water, is the level at which the CDC promotes adding to water. Notice that this is 250 times higher than the level in mother's milk. So 1 part per million is not a small number. In nature's terminology, it's a very large number. Just as it would be a very large number if we were talking about arsenic, or if we were talking about dioxin, it would be 1,000,000 times too much. 4 parts per million is the EPA's maximum contaminant level. Above that level, you are required to remove the fluoride from the drinking water. There's some places with very high natural levels, and they have to remove it above 4. The level in mother's milk. What does this very low level in mother's milk tell us? It is consistent with the fact that there is no evidence which supports fluoride being an essential nutrient, which makes, I think, the fact that it works topically, again, is evidence that it's not a nutrient. Tell me another nutrient that you don't have to swallow. When we look at the toxicity of fluoride iron, we can understand why nature would keep it away from the baby's developing tissues. And now the American Dental Association agrees. On November the 9th, 2006, the ADA told its membership, but not the public, and didn't put out a press release, but said to its members, if using a product that needs to be reconstituted, this is talking about baby formula, parents and caregivers should consider using water that has no or low levels of fluoride. Think about that. Is anybody in Calgary telling women not to use tap water to make up baby formula? If they did decide to do that, how are they going to tell everybody? How are they going to communicate that? And what are they going to do about families that can't afford bottled water for this purpose? The baby's developing brain. The ADA's concern, the reason that they're concerned about and put that thing out is because it's now clear that the most vulnerable year for developing dental fluorosis, which I shall be talking about later, which is a mottling of the enamel, is the first year. You want to keep fluoride away from the first year. So their concern is about dental fluorosis. My concern is damaging the baby's developing brain. Why? Because at birth, the baby's blood-brain barrier is not fully developed. And that means that fluoride can easily get into the baby's brain. This is not the time that the baby should be exposed to fluoride at 250 times the level of fluoride that fluoride occurs in mother's milk. This is what Arvid Carlson, back to Arvid Carlson, said in 1978, and he offered it as one of his reasons for opposing fluoridation. He says, one wonders what an increase in the exposure to fluoride, such as occurs in infants bottle-fed with water diluted preparation, may mean for the development of the brain and the other organs. He won his Nobel Prize for mechanisms in the brain. I mean, that's his speciality. That's what he said in 1978. How prophetic that was, because since he made that statement, there have been over 40 animal studies which indicate that fluoride can damage the brain. Many of them at high doses, but at least one of them at very low doses. These guys fed rats 1 part per million fluoride in their drinking water for 1 year. And what they found is the rats developed kidney damage, brain damage, had a greater uptake of aluminium into the brain, and beta amyloid deposits, which are characteristic of Alzheimer's disease. That's just feeding rats at the same level that we fluoridate the drinking water. There have also been now 18 studies, 17 from China, some of them are getting translated right this moment, and one from Iran from last year, which indicate that fluoride can lower IQ in children. Zhang and co-workers published this study. They compared the IQ of children in 2 villages, one with fluoride less than 0.7, another with fluoride between 2.5 and 4.5 parts per million in their well. The only differences that you can see, and I visited these villages in January of last year, the only differences that you can see between these villages, where the population has been stable for hundreds of years, the occupation is the same, they're all rural farmers, the diet is the same, the educational system is the same, everything's the same, except for this one incredible thing, if you're doing epidemiology, that they had different levels of fluoride in their drinking water. And what they found was they controlled for iodine intake and lead intake. That's very important because both iodine and lead can be a confounding variable here. He found that children in the high fluoride village had IQ lowered by 5 to 10 IQ points. And it shifted the whole curve over. And what does that mean? That means you halve the number of geniuses in your society and you double the number of mentally handicapped. If you shift everybody over by 5 to 10 points, it doesn't make a huge difference in the middle. You wouldn't notice it as a parent. But the 2 wings, you notice. Half the number of geniuses, double the number of mentally handicapped. By extrapolation, he estimated that IQ in children would be lowered at 1.8 parts per million. No margin of safety here when you consider that there are only several hundred children in this study, and if you're going to allow for all the millions of children in society and the whole range of vulnerability that Jim was talking about, that's no margin of safety. For too long, this debate has been controlled by dentists, by the dental lobby. Is it more important to protect our children's teeth than to protect their brains? Many of the people that are making pronouncements about safety have no medical training whatsoever. They only know about teeth. And for that matter, they only know what they're told by their organizations. Some people are very sensitive to fluoride. Now, this is from a drug company talking about a study by Feldman and Kossel, which is a 14-year study in which they administered to patients 1 milligram of fluoride per day. That's the equivalent of drinking 1 litre of fluoridated water, 1 part per million, maybe 1 and a bit litres at 0.7. What they found that 1% of our cases reacted to this. They gave the kid either, or the pregnant woman, either a drug, the fluoride, or a placebo. They didn't know which was which. And 1% had skin rashes, dermatological change, some had gastrointestinal problems, some had neurological problems. If they stopped giving the tablets, they cleared up. If they went back to the tablets, it started again. Pretty convincing, but never followed up by any government fluoridating its drinking water. This has been these people have been left out to dry. They're just being denied as anecdotal. However, it's interesting that this study done in 1997, the authors write, following the end of water fluoridation, the significant decrease in the number of skin rashes leaves room for speculation, seeming to favor the view that a small segment of the population may have some kind of intolerance to fluoride. A bit bloody late, 1997, to admit this. But this is something which has to be done. This needs to be taken seriously. Other tissues threatened by fluoride: the teeth, dental fluorosis; the bones, skeletal fluorosis, the first symptoms of which are identical to arthritis, and increased fracture risk; the endocrine system, the pineal gland and the thyroid gland, and others, but I'll concentrate on those two; and bone cancer in young men is a possibility, and I'll talk about that. So let's start with the teeth. Dean, H. Trendy Dean from the US Public Health Service, who started all this stuff in the 1940s, classified dental fluorosis, which is a mottling of the teeth, into these categories. Questionable categories, slight markings on the teeth, white specks, little streaks, not much. Very mild, up to 25% of the surface impacted. Mild, up to 50% of the tooth surface is affected. Moderate, up to 100%, including 100% of the surface affected. And severe, not only discolored, but pitted, and the shape of the teeth is sometimes changed. Let me show you what this looks like. This is very mild. This is up to 25% of the tooth surface. I think you can see the opaque white regions. This is mild, where up to 50% of the tooth surface is impacted. This is moderate. This is 100% of your tooth surface impacted. And you see also the discoloration taking place. It's no longer pearly white. And this is severe, where you see not a chipping and pitting. Now, when they started fluoridation, they felt at the 1 part per million, only 10% of kids would have the very mild condition. That condition, 10%. And that was the trade-off. They thought that this would be, and some of the very mild is less than that. Sometimes you only see, it's up to 25%. You only see the opaque areas on the actual cutting edge. Just see those white things there. And they thought that was acceptable. But now, this is a survey done from data collected in 86, 87, published in 1997. In fluoridated communities, 0.7 to 1.2, 22.5% have very mild, 5.8% have mild, 1.3% have moderate, none have severe, thank goodness. That's nearly 30%. And since those figures were published, they've gone up about 9%. So about 40% of kids in fluoridated communities in the United States have dental fluorosis of one level or another. And just to remind you, this is moderate dental fluorosis, and this impacts 1 in 100, 1.3% are paying this price. And no government that is fluoridating is compensating these parents. They're not coming through and saying, well, we put fluoride in your water and we're going to pick up the bill for this because you're one of the unfortunate victims of our policy. This costs approximately $1,000 a tooth to correct. Okay. In 2005, the CDC has gone up by 9%. Here's Dr. Hardy Lineback, former president of the Canadian Association for Dental Research, a long-time promoter of fluoridation, has changed his position. He's now opposed to it. He says it's illogical to assume that tooth enamel is the only tissue affected by low daily doses of fluoride ingestion. Unlike dental caries, this is a systemic effect. It's through the system. And if you're getting enough, if you've got fluoride that's damaging that growing tooth, what's it doing to the other tissues? And this is the great fluoridation gamble. When the US Public Health Service endorsed fluoridation in 1950, there were no published health studies on anything except dental fluorosis. So what was the gamble? The gamble was that fluoride could damage the growing tooth by some systemic process without damaging any other growing tissue. Since 1950, the US Public Health Service has shown little interest in testing this unlikely proposition. Few resources have been put into studies on the possible effects of fluoride on any tissue other than teeth and the bone. And I told you already about the neglect of people that may be very sensitive to fluoride. Dental fluorosis is a biomarker for overexposure to fluoride, but it's not being used in the United States or other fluoridated countries in epidemiological studies. It's a non-invasive, visible, simple to classify marker that your child has been overexposed to fluoride. It is the superb tool which you could use to gauge whether there's any relationship between fluoride exposure and lowered IQ, early onset of puberty, attention deficit syndrome, all bone fractures, all kinds of things not being done. An obvious thing not being done. Why not? Key question, when fluoride is causing dental fluorosis in your children's teeth, what is it doing to their bones? Well, interesting, because the first study that was completed, which examined health effects in children, found damage to bones. They found in the New York trial, comparing Newburgh and Kingston, that the fluoridated Newburgh had about twice as many cortical bone defects as the unfluoridated communities. The cortical bone is the outside layer of the bone, which is important to resist fractures. The inside of the bone, the trabecular bone, is good for compression fractures, but the outside of the bone is important for those other fractures. Well, as I said, in the United States they haven't looked at it, but in Mexico they did. Larson Herrera and co-workers looked at bone fractures in children in a high area, 1.5 to 5.5 parts per million in the drinking water. And they found a strong correlation between the severity of dental fluorosis and the incidence of bone fractures in children and adults. So here's the Dean index, no dental fluorosis, very mild, mild, moderate, and severe. The frequency of bone fractures reported in the local clinics, you see it doubles from no dental fluorosis to very mild, doubles again. There's the red is the children, doubles again from very mild to mild, and not quite as much the next time from mild to moderate. Very striking. Nobody in the world has attempted to repeat that. Certainly not in the United States. If you don't look, you don't find. All they've done is to criticize the methodology of the study. Arthritis. The first symptoms of fluoride poisoning of bones are identical to arthritis, stiffness of the joints, aching joints, and pain in the bones. 1 in 3 American adults, that's about 68 million people, have arthritis in the United States. No fluoridated country is collecting fluoride bone levels in a systematic fashion to check a possible connection between fluoride exposure and arthritis. We could have millions of bone samples now at autopsy. During hip operations and so on, we could be getting our doctors to save a little bone and analyze them for fluoride. My son and I looked at the literature worldwide to see how many fluoride levels we have in the bones of people living in fluoridated communities. 1,400 worldwide since 1940. 1,400. In the United States, 192. We should have millions of data points. We have 192. If you don't look, you don't find. Another key question. 50% of the fluoride you take in each day gets stored in your bones. We've known that for ages. Will this lifelong accumulation increase your risk of a hip fracture when you are elderly. This is the bone that we're worried about. This bone here, which joins the femur to the pelvis. This is what frequently breaks in elderly people. And the question is will fluoride damage this cortical layer and make this more likely? Well, animal studies say yes. Clinical trials say yes. Epidemiological studies are mixed. The most important one, in my view, is this one done in China in 2001, where they looked at 6 villages. Again, the only obvious difference in these villages is the level of fluoride in their water. They compared the frequency of hip fractures in these elderly people with this one village at 1 part per million. And there was no difference in the hip fractures in the villages less than 1 part per million. And that has been enough for some people to conclude, no problem. But if you look at the village of over 1.5 parts per million, they doubled. The rate of hip fractures doubled. It goes down slightly for the next village, but by the time you get over 4 parts per million, the frequency is tripled. It's tripled. And so, even though this is not statistically significant, this looks very much like a linear relationship. And so we have the information that hip fractures might double at 1.5 parts per million. The pineal gland. The pineal gland is in the center of the brain. It's not protected by the blood-brain barrier. It has the second highest perfusion rate of blood except the kidney. And it is also a calcifying tissue, like the teeth and the bones. And when Jennifer Luke, oh, by the way, it also makes melatonin, an incredibly important hormone which it's like a biological clock regulating all kinds of things. And Jennifer Luke found that the average level in the crystals formed in this pineal gland was 9,000 parts per million, went as high as 21,000 parts per million in human corpses. And she also found in animal studies that it lowered melatonin production and the animals reached puberty earlier, which is consistent with lower melatonin levels. And she also noticed that first study that was done in Kingston also found that the young women in fluoridated community were menstruating 5 months earlier on average than the non-fluoridated community. They didn't think it was significant at the time. Maybe it was after all. The thyroid gland. Doctors in Europe used to give patients suffering from hypothyroidism, overactive thyroid gland, fluoride tablets, to lower the activity of the thyroid gland. The doses that these people used, Galetti and Joyer in France, was between 2.3 and 4.5 milligrams per day. So someone drinking 4 liters of water is close to that level. And some people do drink 4 liters of water. Some people drinking less water than that, who are getting fluoride from other sources, could easily overtake that level. We have millions of people in the United States with underactive thyroid gland. And once again, nobody, I mean nobody, has looked to see if there's a relationship between water fluoridation and hypothyroidism. None. Meanwhile, in the Ukraine, they found lowered thyroid function at 2.3 parts per million. This is natural fluoride, 2.3 parts per million. Osteosarcoma and fluoridation, a case study in politics versus science. Let me speed up. In 2001, Dr. Elise Basson, the dentist, successfully defended her PhD thesis at Harvard. She found in a case-control study, which is the best, that if young boys were exposed to fluoridated water in their 6th, 7th, or 8th years, they had a 5 to 7-fold increased risk of developing osteosarcoma. That's a rare bone cancer, but it's the most frequent cancer in young people, and it's frequently fatal by the age of 20 compared to non-exposed boys. So that was the science. What happened to that science? Between 2001 and 2005, Basson's thesis advisor, who signed her thesis, Professor Chester Douglas, has 3 times concealed her findings. He gave a presentation in England, said, my work shows no relationship between fluoridation and osteosarcoma, and just forgot to mention his student's thesis. He wrote something to the National Research Council. Again, this time he said his work did not relate osteosarcoma to fluoridation. This time he gave her thesis as a footnote, but didn't explain that the thesis completely contradicted what he was saying. Douglas promotes fluoridation and is also a consultant for Colby. Well, maybe that doesn't mean too much. In January 2005, acting on a tip-off, my son went to the Harvard Library, the rare books section, eventually found this thesis. He was only allowed to copy 10% of it. We had to get somebody else to go there to get the whole chapter on this particular issue. This was subsequently covered by the Wall Street Journal and so on. Then the Environmental Working Group demanded an investigation of Douglas by the National Institute of Health. The National Institute of Health gave it to Harvard. Harvard exonerated Douglas of deliberately concealing Bassen's findings. It's interesting, the word deliberately. Maybe he concealed it, but he didn't do it deliberately. He was a befuddled old twerp. Harvard won't explain their verdict. Bassen now has published a research in May 2006 issue of Cancer Causes and Control. Douglas promises a study which will discount Bassen's findings. It was due in the summer of 2006 and we're still waiting. This month, Douglas received an award from the International Association for Dental Research for his work. Proponents of fluoridation counteract health concerns by arguing that they only occur at high doses, but they don't explain what high means. And what they don't do is the margin of safety analysis.